नमस्ते दोस्तों। आज का मौसम इतना सुंदर है कि मन करता है बस खिड़की के बाहर देखते रहें और गरम गरम चाय का मजा उठाएं। लेकिन डायबिटीज के हर एक डॉक्टर के मन में या दिल में ये सवाल उठता है, क्या ये डायबिटीज है? Can we all be mute, please? तो ये बात हर एक डायबिटीज के डॉक्टर के मन में उठती है कि आशा है कि हमारे सब मरीज खासकर बरसात के दिनों में अपने पैरों की देखरेख कर रहे हैं और उन्हें बीमारियां और इन्फेक्शन से बचा के रख रहे हैं। हर साल भारत देश में हजारों लोग अपंग होते हैं डायबिटीज की वजह से, क्योंकि उनमें विच्छेदन या एम्पुटेशन निश्चित हो जाता है। इसकी शुरुआत बहुत ही मासूम से दिखने वाले छालों के साथ होती है और फिर वो बढ़ता जाता है। ये छाले हम बिल्कुल ही निवारण कर सकते हैं उनका, और यही सब बातों को मन में रख के हमारे RSSDI के विशेषज्ञों ने एक अभियान जो कि बहुत ही ऐतिहासिक है और महत्वपूर्ण भी, सेव द फीट एंड कीप वॉकिंग, ये है अभियान का नाम। इसका प्रक्षेपण होने वाला है 10 जुलाई से। तो आज हम चर्चा करेंगे इसी के बारे में, एंड फॉर दैट आई इनवाइट डॉक्टर अमित गुप्ता, हु इज एन इंटीग्रल पार्ट ऑफ आवर सोशल मीडिया टीम and also a co-opted member of the executive committee of RSSDI. He will be moderating today's episode. And I also invite Dr. Vijay Vishwanathan sir, who's not only the vice president but also coordinating the entire campaign, Save the Feet and Keep Walking. We also have Dr. Sanjay Agarwal sir, who is coordinating with him. He's the national secretary of RSSDI. Welcome, sir. We have Dr. Banshi Saboo sir, who is the immediate past president of RSSDI and also a successful public health campaigner, and he's an integral part of our core RSSDI team. Welcome, sir. And we have Dr. Sharad Pendsey sir, who's a senior physician diabetologist and an integral part of our diabetes foot task force of RSSDI. Welcome to the show, sir. And I hand it over to Dr. Amit.
Thank you, Dr. Purvi, for introducing the session and introducing all the stalwarts here who are present in this telecast. So briefly, I would start the discussion. First of all, I would like to ask Dr. Sanjay Agarwal, because many months ago we were discussing with Dr. Sanjay, and he was constantly telling us that this year we need to do something on the foot. So, sir, I would like to ask you that why foot? Why you have chosen this particular theme, Save the Feet and Keep Walking campaign this year?
Thank you, Amit. I think let me start with a little bit of history. That we know in our country that we have the second largest population of people with diabetes in the entire world. Given the fact that we have such a huge population, and even if we expect a smaller percentage of people, which actually translate into large numbers, having complications of diabetes, then we are talking about people who are not going to have a good quality of life. Now, if you look at across the board, which is the most common problem that people face, other than having a stroke or having a heart attack or other comorbidities, is a foot problem. The whole ethos about RSSDI is to bring awareness about diabetes and problems related to diabetes to every person in this country. They have to test their sugars. That's the first rule that we would like to follow. And for that, last year we ran the Defeat Diabetes program, which, we brought this awareness to more than 100 million people in 100 days. And we urged 1 million people to test their blood sugars in a single day, which got us into the Asia Book of Records. So that was the first principle that we followed. And thanks to the vision of Dr. Banshi Saboo, who, during his presidency made this campaign extremely popular. Now, having said that, the next important thing is that once you know that you have diabetes, how do you detect complications early? That's the next important thing that you need to sort of look at. And from that point of view, it was important that feet is a very important part of our body. We need to preserve feet to keep walking. Ask people who have had their limbs amputated or people who cannot walk because of pain or disfigurement, how bad quality of life they tend to have. And if we can identify feet at risk early, then perhaps we can prevent advanced foot disease, which will ultimately lead to amputations and gangrene and various other disfigurements, which is really not good from the patient's perspective. So that's why the next important campaign that we have taken up from the RSSDI is preserve your feet, identify early any foot related problems, whether it is nerve related, vessel related, mechanical related, or you see early signs of foot involvement in, which will identify that this patient is going to progress into full foot disease. Then we need to begin early to take care of their feet and make sure that they don't land up in problems at a later point of time.
Thank you, sir. I think you have very well highlighted the importance of this campaign. Now, I would like to ask Dr. Vijay Viswanathan, sir, first of all, let me congratulate you for conceiving this entire idea of Save the Feet and Keep Walking campaign. And I know you have been working on this for almost 6, 7 months. And now the day is coming, and very soon we are going to launch this campaign just day after tomorrow. So, sir, I would just like to know that what is this Save the Feet, Keep Walking campaign? So, can you tell our viewers more about the campaign?
Thank you, Dr. Amit. Uh, as you heard from Dr. Sanjay, I think diabetic foot is the most expensive complication, is the most avoidable complication, and it's the most neglected complication. Avoidable, expensive, and it is the most neglected complication of when we talk about the heart, kidney, everybody is worried, but foot, nobody seems to be worried. So we decided in RSSDI, the vision of our immediate past president who did defeat diabetes. But this year, being the 50th year of our RSSDI, which is the one of the largest organizations for diabetes in the world, we thought we will take the feet because it's the most neglected, avoidable complication. The foot is a structure which has 26 bones, 33 joints, and more than 100 muscles. And it's a very complex structure, and you can have loss of sensation, and which is the starting point for an amputation and losing the feet. So we chose this theme, save the feet and keep walking, because you need the 2 feet to keep walking. So we've chosen this theme, and we are going to screen 100,000 people with diabetes across the country. And this is what we are planning. And we have formed a task force for that. Dr. Sharad Pendsey is there. And we have had very good cooperation from the RSSDI Secretariat, Dr. Amit Gupta, for this campaign. Thank you, Amit.
Thank you, sir. Bansi sir, now I would like to ask you that you are known for your leadership, dynamism, thinking out of the box, and thinking big. So, how do you see this campaign, sir?
अमित, सबसे पहले तो मैं अपने सभी व्यूअर्स जो हमारे को डायबिटीज बाइट्स पर रेगुलरली फॉलो कर रहे हैं उनको वेलकम करता हूं। एंड हमारा पर्पस जो डायबिटीज बाइट्स का है वो है अवेयर करना, और हम जो भी डायबिटीज के रिलेटेड आरएसएसडीआई में कोई भी कैंपेन करते हैं तो उसको सोशल मीडिया के ऊपर ज्यादा से ज्यादा लोगों को इस चीज का पता चले, वो हमारा कैंपेन का मेन मकसद है। As far as campaign is concerned, I'm sure it will be grand successful, because we have now, as we know that we are having largest number of doctors who are member of our team. RSSDI is largest body. We have now nationally more than 21 chapters. Each chapter is having a state chapter secretary, chair, along with executive committee member. We also reached out to district coordinator. We have 745 districts, and each district is represented by district coordinator. We are also trying to reach out now each taluka by taluka representative also. And for each and every complications, and in different, like for type 1 diabetes, we have created task force. Similarly, we have created a task force for food problem also. And we have very senior most diabetologist and diabetic foot specialist with us, Dr. Sharad Pendsey. So they are all the part of this diabetic foot task force across the country. We have Central, North India, South India, from everywhere. And then, Amit, who is a hard worker with us, who is an executive committee member. So I'm sure this program, this campaign will be very, very successful. And we can see that across the country, many young diabetologists, very enthusiastic doctors of RSSDI members, they all are actively participating. And day after tomorrow, when we will be launching this project, within 1 month, the target number which is given by RSSDA Central Committee and Vijay, we thought of that we will be checking more than 100,000 feet. I'm sure we will do it. We have already created a website, a app, and whatever the data which we will be collecting, it will be huge data also. So from scientific point of view, as a RSSDI is a research society, we will be having a huge data for us to reveal. That data will be revealing what type of problems which we have in our country. But at the same time, this will create a huge awareness in society. And as Dr. Vijay was talking, that it is a very much neglected complication of diabetes from patient point of view, but I will say even physicians, the general practitioner, they also neglect this complication. It is not the just patient does not understand the importance of the food problem, but even the doctors, the clinicians, even primary care physician, they just forget to ask the patient about the complaint about the food. They don't examine. Patient is just sitting across the chair table and they don't talk to a patient related to the food problem. So that's really a neglected problem. And this campaign will increase the awareness. And I'm sure in near future, we will find that more awareness will lead to less and less complication, or at least amputation can be significantly reduced in our country.
Thank you, sir. Dr. Sharad Pendsey, sir, I have two questions for you. But before that, I will take one question. Yes.
Sanjay wants to go for some meeting.
So, yes. So I will be asking first to Dr. Sanjay. Dr. Sanjay, sir, who can participate in this campaign? What exactly are you targeting at?
So essentially, we are sort of rolling it out across the entire country, and we are urging all the doctors, whether they are part of the RSSDI membership or not, to join this campaign. And they need to register on our platform, so that there will be a questionnaire that they will need to fill up, which will give us the data, and as well as we will have some kind of a risk score which will identify how many patients have got a mild disease, moderate disease, or a severe disease, to alert patients as to what is their which spectrum do they lie in. Now, every patient who has diabetes can get their food screened. So there is no sort of restriction or a age group or gender or duration of diabetes or anything. The idea being that even if they have a short duration of diabetes, we want to get the message across that they should test their feet, they should look at their feet, and everybody should have this practice of looking at their feet. So it's not that people who have got, let's say, 5 years of diabetes or 7 years of diabetes or 10 years of diabetes are the only candidates who will be part of this program. We want every patient with diabetes to be screened by the doctor to see what is his risk for developing a diabetic foot disease, irrespective of where he lies in that entire spectrum of diabetes. And it is important that every doctor participates in this campaign, because we want to see that doctors across the entire country, whether they are in urban areas, rural areas, talukas, wherever they may be, they should be part of this campaign, because it will help us to identify more and more people who are unaware that they have diabetic foot disease early, and maybe save a lot of future grief for those patients. Also, it will become a culture for the patient to see that they check their foot every day, and that will help in the long run to keep them more healthy, and the foot and their feet more walking, rather than be incapacitated because of diabetic foot disease. So everybody is a part of this campaign. Every doctor is a part of this campaign, and we would encourage more and more people to join this campaign. It's a month-long campaign with the idea that we don't want to miss out anybody. We want to see that everybody has opportunity in 1 month time to at least visit a doctor and get his foot examined.
Very well said. So that brings me to my next question to Dr. Sharad Pendsey, sir. You have been working with diabetic foot extensively for more than 3 decades, and you are known as one of the pioneers in the field of diabetic foot. So, sir, I would like to ask from a patient's point of view that what every person living with diabetes should know about diabetic foot.
See, first of all, we should make awareness among both the general physicians, consultants, that every diabetic patient that enters their clinic should be examined without shoes. So ask them to remove their footwear outside, and when they examine the feet, simple things, pulse, peripheral pulse, or sensory system, uh, that gives the message to the patient that my doctor is touching my feet. That means my feet are important. So touching feet carries a lot of importance in Indian context, and therefore every diabetic patient should be at least seen by a physician without shoes, and then we know how to examine for loss of sensations or loss of vascularity by simple peripheral pulse examination. But removal of these shoes and footwear in diabetic patient, at least during first examination, is extremely important. Then, if you feel that there are some changes in the feet, which are trivial lesions or high risk feet, then you can investigate the patient further, because all patients need not go for all screening for neuropathy or vascular disease, because if they don't have high risk feet, they can be seen examined only once in a year. But if you can identify high risk feet, then the frequency can be increased depending on the type of risk involved.
So, sir, for the general public, it would be great if you can identify what is a high risk feed.
हमने अपने मरीजों को ये सिखाना चाहिए कि वो डॉक्टर को इंसिस्ट करे, सर मैं डायबिटिक हूँ, मेरे पैर की एग्जामिनेशन नहीं हुई, आपने सारी टेस्ट किए, ब्लड प्रेशर, कोलेस्ट्रॉल, लेकिन मेरे पैर किसी ने देखे भी नहीं. तो इस तरह का अवेयरनेस हमने अपने पेशेंट्स में जताना चाहिए, खास तौर पे जो मधुमेही है, डायबिटिक पेशेंट्स है, उन्होंने उनको उसका महत्व समझना चाहिए. उसके लिए अपने क्लिनिक में कोई ना कोई पोस्टर या एजुकेशनल मटेरियल पेस्ट किया हुआ होना चाहिए. इससे उनको भी समझे कि अपने पैरों में खासियत है कि वो देखना चाहिए, और कई डॉक्टर्स नहीं देखते हैं तो उनको बोलना चाहिए कि मेरे पैर आपने देखे नहीं. ये बहुत जरूरी है.
ये बहुत अच्छी बात आपने बताई सर कि पैरों का एग्जामिनेशन बहुत इंपॉर्टेंट है. एंड नाउ आई वुड लाइक टू आस्क डॉक्टर विजय सर. Sir, I was reading one of your paper which you published in 1999, and in that particular paper you talked about the importance of increasing the awareness and education among the people with diabetes and their family members. So it has been almost more than 23 years. So what has changed in these 2 decades, sir, when it comes to diabetic foot?
So I think the awareness about diabetic foot has improved a lot since 25 years, ever since I wrote that article. Because at that time, nobody was examining the feet. As Dr. Sharad Pendsey sir said, because of various societies and our talks, and so many people have foot clinics in the country, we have improved the system. And today, foot examination is considered an integral part, an important part of a person with diabetes. So I think things have improved, knowledge has improved, but even we have still a long way to go. As Dr. Sharad Pendsey sir said, people are still concentrating on the eye, heart, kidney, but not on the feet. So I think, as sir said, when somebody enters the room, you should make them remove the shoe and the socks, not only the shoes, socks also, and then examine the feet. And they will go through the foot examination separately, but you should examine as a physician. So things have improved, Dr. Amit.
Yes. Sir, at the same time, it would be great if you can highlight this aspect that for this particular campaign, you have specifically chosen the examination by monofilament. So many of our friends, our colleagues, surgeons, they are interested in knowing that why only monofilament. So what is the science behind using the monofilament alone for this campaign?
Yeah, monofilament has been studied, particularly in the United Kingdom, and published by 3 people, by Kumar, Fernando, and Aris Bevis in Manchester, and it has been shown to be almost 100% sensitivity to detect loss of protective sensation. Specificity is about 77%. It's a very simple tool where you just keep the monofilament, make it buckle for 2 seconds, and take it. Whereas if it's vibration, you have to explain. It's a little difficult to do vibration. Whereas monofilament is much easier, and it's got a very high sensitivity, specificity, as we call it. So that's why we have chosen for this RSSDI campaign monofilament testing in addition to examination of the foot. Thank you.
Yes, so examination of the foot is equally critical, and the monofilament is having very good sensitivity as well as specificity as far as the loss of protective sensation detection is concerned. So, with this, I would like to ask Dr. Banshi Saboo sir if sir is still around here. I think sir is listening. Maybe, sir, Dr. Vijay sir, you can answer that question. So, why diabetes is foot complication? So, what is the science behind this? How does diabetes leads to foot complications?
So I can speak in English if you don't mind. So diabetes affects the nerves in the feet. That's the most common. About 90% of the foot complications in India are due to neuropathy. Neuropathy means disease of the nerves. About 20 to 30% of the foot complications are due to blood vessels affected in our country. So, two major risk factors for diabetic foot complication in India is neuropathy and blood vessel disease, which is called peripheral artery disease. This blood vessel disease and neuropathy is related to poor control of diabetes. So, if you have HbA1c above 8 for a long time, if you have a bad habit of smoking, it can lead to neuropathy and peripheral artery disease. Longer the duration of the diabetes, if you have more than 8 years, 10 years of diabetes, you can have neuropathy and peripheral artery disease. So these are three important factors: smoking, age is also important, age, duration of diabetes, and the HbA1c control in the last, say, 6 or 7 years are the three important risk factors for neuropathy and for peripheral artery disease. Thank you.
Yes. Sharad sir, if you can put these words into Hindi also for our viewers so that they understand it in a better way.
या अपने देश में अक्सर ये पाया गया है कि जो मधुमेही मरीज होते हैं उनमें ज़्यादातर न्यूरोपैथी यानी उनके पैर के जो संवेदना होती है, जैसे अपने को टच समझता है, गर्म या ठंडा समझता है, वो संवेदना कम होती है। ये सबसे बड़ा और महत्वपूर्ण कारण है डायबिटिक फुट होने का। दूसरा कारण ये है कि अपने पैरों में जो खून की नलियां, जिससे अपने को खून का दौरा होता है पैरों में, पैरों तक पहुंचता है, उसमें यदि किसी किस्म की कोलेस्ट्रॉल जमा होना या ब्लॉकेजेस डेवलप हो गए तो उसको हम पेरिफेरल आर्टेरियल डिसीज कहते हैं। अक्सर ये जिनका लंबे समय से डायबिटीज है, जिनकी उम्र 70 के ऊपर है और जो तंबाकू सेवन करते हैं, उनमें ज़्यादातर पाया जाता है और ये ज़्यादा घातक होता है। न्यूरोपैथी से भी घातक खून का दौरा कम होना, क्योंकि उसमें ट्रीटमेंट बहुत अक्सर रीवैस्कुलराइजेशन यानी कि एंजियोप्लास्टी या एम्पुटेशन होता है। और अपने यहाँ इतने मरीज देर से रिपोर्ट करते हैं कि अक्सर एम्पुटेशन ही करना पड़ता है। पर न्यूरोपैथी यानी नसें कमज़ोर होने से जो संवेदना कम होती है, ये अच्छी तरह से रोक सकते हैं। सही तरीके से उनको यदि फुटवेयर या उनके सैंडल्स की जानकारी दी और उनकी हर 3 महीने, हर 6 महीने फुट एग्जामिनेशन अपने यहाँ के नर्सेस ने की या एजुकेटर्स ने की, और उनको बार बार ये समझाया गया कि आपने नंगे पाँव नहीं चलना चाहिए, पैरों में हर वक्त अच्छी तरह के सैंडल्स या फुटवेयर पहनना चाहिए। तो मैं समझता हूँ कई न्यूरोपैथी प्रॉब्लम्स यही स्टेज 1 में ही रोके जा सकते हैं, और जो एम्पुटेशन या अल्सरेशन होते हैं, गैंग्रीन होता है, उसको हम काफ़ी हद तक हमारे मरीजों को उनसे दूर रख सकते हैं।
You are right. I think this is the aim and objective of this campaign, that we want to sensitize the people living with diabetes, their caregivers, as well as the healthcare professionals, that most of the diabetic foot complications are preventable if detected in time and if managed in time. So, treating a diabetic is more difficult, and it is much easier to prevent the development of the diabetic foot. I think this is the whole message which we want to convey. Dr. Vijay sir, so let me ask you on the lighter note. So, how is the Josh sir, and how is the preparation going on for the campaign?
Yeah, I think we have, as Dr. Banshi Saboo said, we have created enough awareness. We have more than 21 state chapters. They have all been given instructions in 2 Zoom meetings on how to go about, how to register, how to fill in the form. So we are all set to start on July 10th until August 10th, and our aim is to get 100,000 people with diabetes across the country. We are all set, Amit.
Right, sir. Sir, one more thing which many people are asking, that the advanced tools are available. We have VPTs, we have Dopplers, and many of these things are available. But I think you have rightly pointed out, but they may not be available at each and every diabetic clinic. At the same time, they may not be available at the tier 2, tier 3 cities and in the peripheries also. A lot of questions are there regarding the clinical examination. So I would like to inform the viewers that if you visit our website, that www.rssdi.in, and you will find the logo for our foot campaign. And once you go there, you will be able to find all the information. We have a very comprehensive evaluation form where a lot of questions are going to be asked. We are going to ask our patients regarding the foot, and the inspection part, and as well as the palpation part, that is the palpation of the pulses, is again done comprehensively in this campaign. So, as far as the tools are considered, because it is not possible to make biothiometers or these things available, and also we have Dr. Vishwanathan has shown that the sensitivity and the specificity of the monofilament is also very good, and I think it is what is advised by all the international authorities to screen first. So I think the campaign has been planned very well, and it is going to be a huge success. We all wish, and we believe that we invite everybody who is watching this campaign or going to watch this video anytime after this telecast. We will request you to participate wholeheartedly in this campaign. And it is very simple. You just need to examine the foot of your patient, whatever number of patients you're seeing. There is no pressure on you that you need to do or commit a specific number of patients in your clinic. You may examine any number of the patients, whatever is comfortable to you. And there is a very simple form which you need to fill, and it can be done within 2 to 3 minutes. So I think Dr. Banshi sir has joined. I would like to ask one question from Dr. Banshi sir also. So Banshi sir, we talked a lot about the patient education. So what role education can play when it comes to diabetic foot? Whether it is patient education, caregiver education, or the SCP education?
So education is required at every place. It is educating the doctor, educating the patient, and educating the caregivers. All three requires education. And education is the integral part of management of diabetes, and particularly for preventing diabetes complication. Any diabetes patient can prevent his diabetes complication if he is educated well. It is not only for education for monitoring, education for keeping the regularly compliant for the medication, going for regularly for the doctor's follow-up, screening for the regularly complication, which are all complications are to be screened in diabetic patients, whether you talk of retina, foot examination, for kidney, for heart, for everything. Because early complication you can definitely prevent. And Vijay and Dr. Sharad Pendsey will agree with me that each and every patient who is getting amputation today, I am sure before few years, he must have developed the minute problem. It may be a callosity, and that was missed by a primary care physician or the doctor who was treating the patient. They have missed that primary problem or a small problem which patient was having, or if we have educated the patient properly at the time of diagnosis of diabetes itself or on the regular follow-up about the diabetic foot problem, probably this minor problem which patient may have developed, patient may get the treatment for that, and we can prevent the complications like amputation. To get an amputation, it's like a malignancy, because most of the patients who develop the amputation in next 5 years, how many of them will survive, that itself is a question mark, and many of them they die. They have developed many other complications, and the patient who develops the complications like up to amputation, I'm sure other complications are also existing in that particular patient. May have retinopathy, may have nephropathy, may have heart problem, they may have heart failure, and mostly the patients with amputation they die very soon. And this is the also reason that we don't see many patients with amputated limb. We don't see so many patients who are coming. Even Dr. Sarath Prince is practicing since last 40 years with the diabetes, and he is diabetic foot specialist. But how many patients he will continue to see, those patients to whom they have developed amputation? He will not see so many patients continuously coming regularly on follow-up, because they develop other complications and they will die. So it is, I think, the education of caregivers, society overall, if we can create a big awareness across the country, this campaign of RSSDI, I'm sure will create a campaign, a awareness, a mass awareness, not only in patients of diabetes, even patients who are not diabetic. Because if I don't develop diabetes, definitely I'm going to prevent myself from diabetic foot complication also. So this awareness campaign will be for prevention of diabetes, for increasing awareness about the diabetes and diabetes complication, and education about different complications, but particularly more stress which we are going to give here for diabetic foot problem. So I'm sure this is going to increase the awareness in our country, and we will have less and less complication. And such campaign are welcome. I think across the world people will follow us, and they will also do similar type of campaign in their country.
I totally agree with you, sir. And I believe you will all agree that nothing pains us more when we see a patient who is coming to us with an amputated limb. And that as amputation has happened simply because the patient was not detected, patient was having a poor glycemic control, or patient was not having any idea about that food can also be involved in the with diabetes. So just one last question before I come to conclusion, sir. It has also been seen that the presence of diabetic foot is also a direct or indirect indicator for the presence of complication elsewhere also. So it has been really correlated with the cardiovascular disease, it has been correlated with the other macrovascular complications as well as the microvascular complications. So I think presence of diabetic for a high risk foot should raise an alarm, which is not only limited to foot itself, but it is all across the body itself.
And one more important information with for patient and caregiver. Sometimes they develop diabetic foot complication, they straightway go to some general surgeon. He does not know anything about the diabetes. Just he tries to, give some insulin, and he chop the things, or he just cut the finger, something like that, which he does, which is not sufficient. So patient should go again to the diabetologist. He will be able to, arrange the diabetic foot surgeon and try to get the best treatment for that particular patient. That's very, very important. Many of the patients, they just go to the just go to the general surgeon. And this is not only in the rural area, even in the urban area, when they have the diabetologist. Even sometimes I see my diabetic patients, they go to surgeon straight away, and then we get the call from the surgeon just for the purpose of getting sugar control. It's not just sugar control here is required. It requires a comprehensive evaluation, as you rightly said, that they may have other complication also, and simultaneously how to prevent further progression of this diabetic foot complication. That is also very much important. Normally, I don't admit any patient of diabetes, and even to the hospitals where I'm attached, I send my junior doctor or my associate doctors to see the patient if they are referred at all. And if any patients of mine require any hospitalization, even they get admitted in that particular specialty. Except diabetic foot and diabetes ketoacidosis. These are the only two problems for which patients get admitted directly under my care. And every day we admit one or two patients for both the conditions. And this is the regularly, like the hospital which is near to my place, we keep 7 and 8 beds only for these two complications for patients already admitted.
Right, sir. So, Dr. Vijay sir, before we conclude, I would like to have your final comments and remarks and whatever you would like to say to our audience, sir.
So I think, Dr. Amit, RSSDI's very prestigious project is the Save the Feet and Keep Walking. We want to prevent amputation, and we request the help from every doctor, every patient, and every person with diabetes for this campaign. And we have 1 month, and we want this campaign to be 100% successful. And this is the first time in the world, as Dr. Banshi said, we are probably aiming to examine 100,000 people with diabetes for food complications. So this is probably for the first time in the world. So India will set an example to other countries in this campaign. So hats off to RSSDI. We have the immediate past president, Dr. Banshi Saboo, the secretary, Dr. Sanjay Agarwal, and everybody in RSDI. Congratulations for taking up this wonderful initiative of Save the Feet and Keep Walking. Thank you, Dr.
I'm sure
Just to inform everyone, Dr. Vijay Viswanathan is not only a senior diabetologist and diabetic foot specialist from Chennai, but he is also the president of D Foot International, which is an organization which is across the world, and all those who are in diabetes foot, whether they are surgeon or they are podiatrist or they are diabetic foot specialist, diabetologist, physician, and vascular surgeon, they all are the part across the world. It's a big organization, and he's currently president of it, D Foot International. He's also currently vice president of RSSDI, and we are really proud of him to start this campaign for RSSDI and for our country, India. Congratulations.
Thank you, Dr. Banshi.
And sir, I think it can't get better than this, that RSSDI has the privilege of having president of D Foot International driving this campaign for the RSSDI in India. He has many responsibilities. He's looking after the global affairs of the D Foot.
So rather, he is starting from India. I'm sure he is starting from India, and across the world, this diabetes foot campaign will go now. Other countries will definitely follow.
So we are setting example for entire world.
Yes, definitely, sir. So D Foot International,
so we will, with the support of each and everyone and all the doctors who are there, all the dedicated team of RSSDA members who are working on this campaign and who are very enthusiastic about this campaign. We have a group where more than 400 doctors have already joined us. More than 400 doctors have already registered for this campaign. It's going to pick up at a very rapid pace in coming days. So, sir, Sharad sir, your remarks, concluding remarks, sir.
I must congratulate RSSDI as well as the whole campaign designed by Vijay and others, because this is a simple thing, creating awareness, educating our diabetic patient, which can save feet, because treating diabetic foot is so expensive, and particularly if the amputation occurs, the life becomes miserable. As Dr. Banshi was saying, the chances of other complications, it's a surrogate marker of cardiovascular disease, renal disease, and therefore, if we can pick up lesions when they are just emerging, we can save these feet definitely and give a walkable feet for long time as a diabetic patient and prevent foot lesions and amputations. So it's an excellent campaign.
Thank you, sir, for your blessings for the campaign and for campaign in development of the campaign. Banshi sir, your final and concluding remarks, sir.
So the congratulations everyone, and I must congratulate here Amit also. Amit is the key person for coordinating this complete campaign under the leadership of Dr. Vijay Vishwanathan and our Deep Diabetes Food task force, which we have created under RSSDI. And definitely RSSDI organization, everybody is with, involved in this campaign. As you rightly said, that each and every person in our country, whether he is diabetic or not diabetic, each and every person's caregiver who is diabetic or the relative of the diabetic patients, if they all participate in this campaign, the awareness itself is going to increase, and we are going to have less and less amputation in near future. That is what I'm looking for.
So, sir, with this, I would like to thank Dr. Vijay Viswanathan, Dr. Sanjay Agarwal, Dr. Sharad Pendsey, Dr. Banshi Saboo, Dr. Purvi Chawla, who coordinated this program and who is regularly conducting RSSDI Diabetes Bytes, all the social media task force members of the RSSDI who are behind this program, which comes to you every week. I will request all of you to join for the oral ceremony of this very optimistic campaign, which is going to happen on 9th of July from 12:30 to 1:30 p.m. Very soon we will be sharing the agenda and the registration link for that. So we will seek your support for this campaign so that we can improve the food care people with diabetes in the country. Thank you everyone. Thank you for joining.
Thank you. Bye bye.
Thank you, sir. Thank you, sir. Bye, sir.